I would like to do video work, but I'm very self-conscious about my teeth. When I'm talking, I look like I don't have teeth, and it is coloured.
When a patient approaches me and says, I want to show my teeth when I'm talking and smiling, there's a reason for that. We know that today people maintain their teeth for their lifetime. And as in the age group between 50 and 60, most patients have got lots of restorations, lots of crowns and bridge work, some teeth loss, etc. But they're healthy and they want to be happy. They want to show their teeth and they're smiling. With all the media and what the expectation of society is, in many ways, smile is a fashion statement, just like a hair change. So the issue is the following. This particular very lovely and elegant patient presented in my practice said, Sarkis, I want to smile and show my teeth when I'm smiling. When I talk, I see my pictures, especially when I take from the side, and I'm doing lots of presentations, a lot of videos at the moment, I just find that my teeth look terrible. What can you do to help me? Well, the answer is very simple. I listened to my patient, and we did a diagnostic mock-up. With the diagnostic mock-up, I established a whole new smile line, the platform where we're going to build a smile. This is no different than any other concept of designing a building, etc. You have to have a level where you start. You got the platform right, and then from there on we build a smile. And in her case, she had worn the teeth down, so her teeth was just her nose and chin is coming too close. There's lots of facial folding because the facial height is reduced. And also when you looked at her, you can see that in a smile, the upper arch is sort of canted. And then one's canted one way, the other one's canted another way. So it doesn't look right. There's a point in time where patients present in my practice say, you know what, a few years ago, I didn't worry about my teeth, but now it's a concern. And I understand that. There's a science behind that reasoning, not just a fashion statement. So today, I'm able to diagnose these problems. There are special aesthetic problems that concerns patients' everyday living. So once we did a diagnostic mock-up for this patient, then we established a smile line platform. What it means in her case, we had to reconstruct both jaws to get the correct bite height. So I open the bite, to create the correct smile line. And so when the teeth come together, they mesh in really, really well. So we did lots of temporary crowns for top and bottom teeth. And once we did the temporary crowns, we remodeled, we reshaped those temporary crowns to get the best smile line, improve the bite. We let the patient chew with those temporaries for a while. He says, you know, Sarkis, that feels really, really good. And then we took some molds of this and we used the molds and improved on the design into the final restorative outcome, which is the new crowns and bridge work. Now you can see this patient. Now I would say she looks at least 10 years younger. All I did was to complement her facial aesthetics. All I did was to put the smile line platform, the shape, the whole arch level, the position of the arch, not only this level, but that level of the arch, and in how we angle things. Well, that's an art, you see, that's what you come into a specialist for. We can't have a computer model that actually models your teeth where you're going to look. This is done in the real mouth. It has to be done dynamically while you're there. That's why diagnosis is so important, because not only I'm adjusting and leveling your smile and creating that special look for you, but we're also testing the system and you're talking to me. You see, we can't do these things on computers. It's going to be done in real life. Okay, and it's important, but we also did very careful removal of the existing bridge work that was there to maintain tooth structure. It's a lot of work. I work under a microscope. It takes me hours to do this work. It takes a lot of concentration, but the planning in diagnosis is the key. It's very important. You know, in my center we have the latest technology that's second to none. I rarely talk about it because it's given. It's given. When you see me, all the technology, all the things that people talk about, they see CAT scan machines and whatever they have, it's given. It's a past data. See, the technology doesn't make you a better clinician, better diagnostician. It's your knowledge, it's your experience, it's compounding called feasibility, where you know if you do this, you're going to get that. It's the whole thing. I have over 30 years of experience in this specialist area. It's very important to understand that. When I look at the patients, I can immediately know what I'm going to do. But what I think what I'm going to have to do is only being complemented by when I do the diagnostic mock-up, look at the whole face, look at the speech, look at how the patient talks, and then I know I'm in the right path for an optimal functional, aesthetic outcome, and that means a biologic integration as well that allows everything else to fit together for the complementing to you and your dentofacial aesthetics.
It's just made me realise how much I've been holding myself back. And I think other people need to understand that when they are doing their video work, the difference of having your teeth done and the way we speak. I can hear my S's, yes. I'm just speaking so differently now. I feel like I want to speak and express myself.
Oh,
wonderful.
You happy?
You're very, very.
And when you come and see me, you can see how long it takes to get things right before you proceed. That journey is the crucial part of your treatment. In many ways, patients tell me they don't remember the fact that there was a little bit of a discomfort here and there, but what they remember is the final work was excellent. We didn't take shortcuts, we did it right. Just like we did right for this beautiful patient, for this elegant patient. We will do the same way, we'll get it right for you when you present in our practice.
Looking in the mirror, I could not put into words what I truly felt at that very moment. My smile had changed. The way I pronounced my words, it just blew me away. It changed everything for me.